Endocrine Wellness. My name is Dr. K, and today I'm going to talk about thyroid nodule. The purpose of this video is to serve as an educational content only. This is not personalized medical advice. So I would recommend you discuss with your physician or provider regarding your specific treatment plan. Thyroid is a butterfly-shaped gland located at the base of your neck that is involved in thyroid hormone production. And thyroid hormone is very important for different functions throughout your body. To name a few, but not limited to, including temperature regulation, metabolism maintenance, very important for heart function, brain function, digestive function. Thyroid nodules tiny growths on the thyroid or lumps on the thyroid. The thyroid follicular cells becomes enlarged or thicker, and they can have one or more lumps in the neck. When the thyroid is enlarged, we call it goiter. When the thyroid forms a localized lump, we call it a nodule. And when they have multiple nodules like that and the thyroid is enlarged, we call it non-toxic multinodular goiter. How common are these thyroid nodules? They are very common. If I were to randomly pick people off the street and do an ultrasound, 1 in 3 people will have a thyroid nodule. And if I have to pick people that are specifically over the age of 50 and above, and I do an ultrasound on them, 1 in 2 will have a thyroid nodule. Now, thyroid nodules in general are more common as we get older. They're more common in females. The good news is the vast majority of them are benign and they do not compromise underlying thyroid function. Of these thyroid nodules, 95% of them are benign and 5% can be cancerous. What are the causes of thyroid nodules? We're not always able to identify the cause of a thyroid nodule. There are some specific associations. For example, if there's a family history of thyroid nodules, then this patient is at higher risk for developing a thyroid nodule. Or if the person was exposed to head and neck radiation or some kind of childhood radiation treatment, that person is at higher risk for thyroid nodule. If they have underlying autoimmune thyroid disease, then they are at high risk of developing thyroid nodule. With autoimmune thyroid disease, there are episodes of inflammation and scarring and healing that happens in the thyroid over a period of time that can make the thyroid gland kind of lump up and look like a thyroid nodule. A lot of these autoimmune conditions also have what we call as pseudonodules, meaning they're not real nodules. They look like a nodule on one view, but then you look at the other view, you're not sure if it's a nodule, so you just have this area of irregularity, and usually these pseudonodules can come and go. But our focus is primarily on the real nodules. What kind of workup do these nodules need? So when you go see your physician with this maybe incidental finding noted on the imaging, your provider will examine your neck to see if they're able to feel the nodules. Some of the bigger nodules you can palpate and feel on the neck. The smaller ones, it's very hard to feel, especially if they're kind of towards the back. At the same time, your provider will also feel for lymph nodes to see if they can feel any lymph nodes. Then we do 2 main testing to evaluate the nodule. One is a blood work, TSH, and sometimes also a T4, to see if the underlying thyroid function is intact. And we also do an ultrasound of the thyroid, because ultrasound is the best way to look at all the features of the nodule, so we can evaluate to see if there are any suspicious features on the ultrasound. In certain situations, your provider may also order antibody testing for TPO, which may indicate Hashimoto's thyroiditis as a cause of the inflammation in the nodule, but we do not routinely do that in every single nodule. If the nodule looks like it has benign features on the ultrasound and the thyroid functions are normal, we just continue to monitor the nodule maybe once a year, depending on the features of the nodule. If the nodule looks suspicious, then we refer the patient for fine needle aspiration so they can aspirate the contents of the nodule and do assessment under microscope to see if there is any features of cancer in them. If the thyroid function tests come back indicating hypothyroidism, meaning low thyroid, or in the blood work it'll show as high TSH, then I may instruct the patient on thyroid hormone replacement. If the blood work shows hyperthyroidism or overactive thyroid, the blood work will show low TSH. In that case, I will order further testing of the nodule with the thyroid uptake scan. This is a nuclear medicine scan that evaluates if that particular nodule is overactive, so it looks like a hot nodule on the scan. The reason this is important is the treatment could be different depending on if it's a hot nodule versus if it's a nodule that is not hot on the uptake scan. What are the complications of a nodule? So the nodule can over time continue to grow bigger, and we would worry about developing cancer in this nodule, or the patient may develop multiple nodules and the whole thyroid can get very enlarged, that it puts pressure on the trachea, esophagus, and other important structures in the neck. Sometimes they can go below the collarbone, well into the chest area. We call that substernal goiter. Or they can become autonomous functioning. They go from normal thyroid function to overproducing thyroid hormone, in which case also we need to treat it appropriately. But vast majority of the nodules just continue to stay the same or have minimal increase in size, and we just need to monitor for these complications of these nodules. That's it today for thyroid nodule. If you have any questions, please email me at the email down below, and I will try to respond to these questions. Thank you.